Thanks everyone for joining me. My name is Vicky Hobbs and I pride myself on being a pregnancy, birth and postpartum specialist. Tonight I've put together this webinar on natural induction methods because I know that so many women don't really know what to do in terms of natural induction methods and whether they're safe, whether they're they're proven methods. And so I just wanted to put a few together to let women know that there are some things that you can try, but it's important to also have some patience as well. So there is an opportunity at the end of the webinar for you to ask any questions. So you can put your questions into the chat box right at the end when I let you know that you can ask any questions. Just a little bit about me. I've had my own business since 2004 and I've been working with pregnant women since 2006. I'm a Hypnobirthing Australia practitioner, an independent childbirth educator, a birth and postpartum doula, a remedial massage therapist specialising in pregnancy massage, a relaxation therapist, life coach, aromatherapist, and a Reiki practitioner as well. So lots of modalities that I do working with women, and then also working with women during the postpartum period as well, because I think that the postpartum healing is really important for women to actually have someone they can go to and have a massage, look at different relaxation techniques as well. So I have researched quite a few different natural induction methods, and I thought that I would share them with you today so that you have an understanding of what works and what doesn't. Sometimes you get to that point where you're so tired and you're so uncomfortable and you think, right, it's time for this baby to come out. You just want to do whatever you can to try and get baby out as quickly as possible. It's important to remember that your baby's due date is really a guess date. Only about 4% of babies are born on their actual due date. That's the date that you've been given by your obstetrician. 10% of first-time pregnancies continue on until 2 weeks past that due date. And 70% of pregnancies go post-term, and they've actually been dated incorrectly from the start. So term can be any time between 37 and 42 weeks. So when you're within that time frame, that's a normal gestation period. Post-term is when your pregnancy continues over 42 weeks. Okay, so any time between 37 and 42 weeks is a normal period of pregnancy, and every woman is different. So your cycles are different. So it's important for you to understand that you're not going to be the same as the person next to you when it comes time for birthing. So we're all individuals and we all have our own cycles that we go by. So the World Health Organization's definition of prolonged pregnancy is one that continues beyond 42 weeks. So again, it's important for women to know that it's quite normal, to get to 42 weeks. But unfortunately, women are sometimes encouraged or coerced to start trying to get that baby out from 38 weeks. And because of this, because women are then starting to be put under that pressure to get their baby out earlier, they start to try all different things. So they do try and all these natural induction methods to try and get babies out, so that they try and avoid a medical induction. So, we have to start going back to basics and saying, that the pregnancy time is between that 37 and 42 weeks, and you should be relaxing. you should be just enjoying your pregnancy and really focusing on doing all the things that you can to get your mind and your body and your emotions all balanced and calm. Obviously, you know, when women are being coerced or bullying at 38 weeks to have an induction, this certainly puts some stress on women, not only on the woman but on the baby as well. So this can release catecholamines into the body, which inhibits oxytocin, which is the hormone that you need to actually go into labour. So if you're feeling stressed and you're feeling anxious and you're doubting your body, you're actually going into that fight or flight response. So you're releasing lots of adrenaline, catecholamines into the system, and that inhibits that oxytocin, which is your labour hormone. So there are natural methods that may help to soften the cervix and also to stimulate the uterus. But when you start trying to make things happen, more often than not, what you're doing is actually preventing them from happening naturally. Remember that even trying to induce naturally can be a form of intervention, meaning you're interrupting a normal physiological process. And again, that's when you start to become stressed, when you start using all these different methods and nothing seems to happen. You know, babies know when they're supposed to come out. You're not going to be pregnant forever. So time to sit back, time to spend the last few days of pregnancy giving yourself permission to rest and relax. Have a bath, you know, put candles around the place. Enjoy the last few days or the last week or two of your pregnancy. Really focus on helping your baby to feel calm and relaxed as well. Things like getting into the bath, going for a walk, getting some fresh air, having lots of rest, you know, having sleep, because you don't know when you go into labour how long your labour is going to be. So you want to make sure that you're energised and really looking forward to having a positive, calm birth. One of the things that I encourage all of my clients, my hypnobirthing clients, my back to basics birthing workshop clients, is to do a vision board. Okay, use the time that you have before you give birth to prepare your mind for a positive, calm birth. That's really important. So using powerful images to visualize your cervix softening and opening, putting really strong words on your vision board to remind you of things that you need to do, like breathe, just breathe. You've got strength, saying to yourself that I can do it, I trust in my body, using lots of different images of birthing women, or images that help you to visualize your cervix opening up really gently and slowly and calmly. Visualize your baby's head pushing up against the cervix, so that that stimulates the hormones that you need to soften the cervix and start effacing the cervix, dilating the cervix. Everything needs to be a slow, calm, gradual process. And you need to trust in your body. You need to trust that your baby knows when it's ready to be born. You need to trust that your body knows what to do to get your baby out. But certainly creating a beautiful vision board for your birth can be very beneficial as well. Go and have a labour focus massage. That'll ease any tension in your body. It'll start to prepare your joints and your ligaments and your muscles for when you're in labour. And you know, I'm doing so many labour focus massages now. Now that a lot of people have read the blog that I did recently, in terms of the ligaments, the lumbar area, the pelvis, the glutes, which are your bottom, your legs, your hamstrings, your quads. You know, all of those muscles contribute to the tension around the pelvis. So one of the best things you can do is actually go and have a great massage with somebody who knows what they're doing, someone who knows how to release the psoas muscle. I talk about this all the time. Women who have long, drawn-out labours, usually it's the psoas muscle that's inhibiting the baby from moving down. The ligaments are tight and tense, so baby can't move down. So going and having regular pregnancy massage leading up to when you go into labour, and then once you get towards your due week, or your due, early in your due month, having labour focus massages. So from 37 weeks, go and see a pregnancy massage specialist, someone who specialises in pregnancy massage, who knows how to release all of that tension through the sacrum, through the pelvis, through the legs, through the bottom, and it'll make the world of difference. I've actually just, I've been working with, like I said, a few mums, and I've had 2 mums recently. One of them in particular had 6 sessions of massage with me. 2 of those, the last 2 massages she had, were labour focus massage. So this was a couple of weeks ago. She came on the Friday and we did 1.5 hours. So 1 hour is actually just the pregnancy massage, and then half an hour is the labour focus, so doing acupressure points while they listen to a self-hypnosis track, okay, to get the mind in balance with the body. So it's all about that calmness. It's all about that relaxation, helping you to feel calm and confident. So here, identifying any fears or concerns that you might have and releasing them. So when you're stressed, you're releasing catecholamines into your body. So they're the stressor hormones. They're inhibiting the hormones that you need to go into labour. If you've got any sort of fears or concerns or doubts, doing a self-hypnosis can really help to alleviate those and release those, connecting the mind and body so that your mind becomes ready to give birth, and then your body becomes ready to give birth as well. So really important for women to actually release any fears or concerns that they might have about their pregnancy, about their labour, about their birth, about the postpartum period as well. So if you have any fears, you actually need to work on those and release them. So I've long held a belief that women need to be in the birthing triangle, and this is a triangle that I created to give women that visualization. What it means is that their mind, their body, and their emotions need to be balanced. They need to be connected. They need to be ready. They need to all be working together on the same level. That is when your baby knows that you are ready. And that's when your baby starts to trigger those labour hormones. So that's what you need. You need to remind yourself of that birthing triangle, the mind, the body, the emotions, so that they're balanced and connected and ready. So evicting your baby before they're ready can set off a whole new set of circumstances that could lead to complications, medical interventions, stress and uncertainty. So who wants that? Who needs that? What you want to have is that birthing triangle, the mind, the body, the emotions, all in balance, all working together, and then working with your baby. And then you'll notice when you start to feel calm and relaxed, you've had pregnancy massage, you've released your fears, and then everything just seems to fall into place. And that's when you'll start to notice maybe a bit of mucus plug. You'll start to notice that you're getting a few niggles here and there. But just take that time to really enjoy the last few weeks of your pregnancy. You know, don't try and stress yourself out with all these different methods of induction, even if it's a natural induction. So natural induction methods, are they your friend or are they your enemy? So as I said, I've researched a few well-known natural induction methods which may help to stimulate the cervix or the uterus. So there are so many methods that are suggested out there, and so I only chose a few of the really most common ones, so that you can decide whether they will suit you in terms of trying to start things off naturally. But do they work? So none of these methods are 100% successful. And let's face it, like every pregnancy, every labour and birth is going to be different. It depends on the woman and her body and her baby. So most of the evidence supporting these methods are anecdotal, meaning they're based on testimonials from women who have used them. There's very little or no scientific evidence supporting them or debunking them. And no evidence on whether they're safe. Okay, so you need to use your brain technique. You need to look at what are the benefits of doing this? What are the risks involved? What are the alternatives? What are my instincts telling me? And what if I do nothing? So we have to look at the safety behind using some of these techniques as well. So always with safety in mind, it's important to, if you've got a pre-existing condition, if you've been unwell, if you're considered high risk, that you check with your health provider before trying any of these methods, just to make sure that, you know, things aren't going to go south for you if you start trying some of these natural induction methods. So, you know, and sometimes the healthcare providers won't know themselves, so they'll need to do a bit of research based on your own individual circumstances. And are the people that you go to for some of these induction methods, are they qualified? Are you going to feel safe working with someone, you know, taking herbs or having a pregnancy massage? So make sure that you're working with a qualified therapist for the techniques that you want to try out. So again, you know, seeing a qualified pregnancy massage specialist who is trained in the labour focus massage, who's trained in acupressure. If you want to try acupuncture, obviously you need to go to someone who's trained in that. Reflexology is another one, traditional Chinese medicine, naturopathy, homeopathy. So all of these techniques, you need to make sure that you're going to a qualified person so that you can feel safe and sure that they know what they're doing. So here's one technique which is really popular, and this is one that I also encourage women to try, is acupuncture. So this has been used for over 3,000 years by traditional Chinese medicine practitioners and doctors. It's a specialised treatment for women in pregnancy care and postpartum recovery. So it's becoming increasingly popular. It also helps to enhance the women's well-being. So for acupuncture, you should be starting your pre-birth treatment, weekly acupressure sessions from 36 to 37 weeks to prepare your body to go into labour. So this actually helps to ripen the cervix. It helps to position baby in the best presentation for birth, and also helps women to become deeply relaxed. It works on stress. So if you're feeling stressed, go and have some acupuncture, because that's where we need you to be. We need you to be calm. We need you to be relaxed. We need you to feel confidence in your birthing body. So going and having some acupuncture can really help with the relaxation side of things. Acupuncture to stimulate labour, so induction acupuncture, should only be used near the end of your pregnancy, or if there's going to be any medical intervention. So there's loads of really qualified acupuncturists around Perth. The one that I use that I refer most of my clients to is the East Meets West Chinese Medicine in Chewett Hill. Ian and Michelle, they're both registered nurses, and you know that they specialise in pregnancy acupuncture. So they're great to go and see. They are very busy as well. Labour focused massage. So I've talked a little bit about this. So this can help your body to relax, to ease the tension, while at the same time calming your mind. And again, that's exactly where you need to be. So just like acupuncture, labour focused massage can be given on or before your due date. The massage therapist should be trained and qualified in pregnancy and maternity care and experienced in this type of massage. So again, it helps you to relax, calm your body, release any tension, clear away any doubts, letting go, promoting breathing as well. So nice deep breathing through your massage. We usually, when I do a labour focused massage, I'm usually using essential oils as well. And essential oils also help to get you deeply relaxed. And one of the main ones is Clary Sage. So I use that during my labour focused massage. And that works on the central nervous system to help you feel even more deeply relaxed. If your body and your baby are ready for labour, a labour-focused massage can help facilitate those contractions, because again, the mother becomes mentally balanced. She becomes physically and emotionally balanced, which then encourages the release of labour hormones. So also keeping in mind that regular pregnancy massage will also help with lots of benefits. So increasing the circulation through the body, helping with swelling, so edema, helping with any pain through the pelvis and the hips, which is usually where mums experience pain, helping with pubic symphysis dysfunction. So, you know, really working through the adductors. So that's like the muscles around the inside of the legs heading up towards the groin. So really getting into those muscles to help release the stress and tension around that area. So I'm a qualified Nurture Life practitioner with Pregnancy Massage Australia. So I've received specialised training in pregnancy massage and labour focus points. So in my experience, when I've worked with women doing a labour-focused massage, which is also called an induction massage, but we prefer to call it a labour-focused massage, women go into labour generally within 24 hours after having the massage. Was it the massage? Who knows? Was it just that the massage helped bring that woman back into that balanced triangle of mind, body, emotions? And then the baby felt that mum was ready and started initiating labour to start. So a labour-focused massage will certainly help with the ligaments and the muscles around the pelvis and the sacrum to release and open the pelvis, giving baby more room to move down. So remember I was saying before, when baby is actually moving down onto that cervix, stimulating the cervix, that's going to release hormones to help soften the cervix and start effacing the cervix, and then start releasing oxytocin. Acupressure. So we can use acupressure on those labour focus points of the body to help stimulate or increase whatever is already happening in the body. I really love using the acupressure points, and I'm really good at it as well. So it's based on our chi and our energy centres. So when the points are stimulated, it may also help to stimulate the uterus to start contracting. These pressure points can also be used during labour, so I do use these when I'm a birth support with women, and it can help to increase the intensity of those contractions and help mum to be more relaxed, and even ease some of the intensity of the contractions that she might be experiencing. So acupressure is a really great way to work with your body for relaxation, energy balancing and stimulation. So I regularly show couples these acupressure points so that they can work with them effectively and also safely. But again, if the body is not ready to go into labour, then this is not going to induce labour, but it will help to promote relaxation and prepare the mum's body for when she does go into labour. So this is one that gets talked about quite a lot, so sex. So semen contains prostaglandins, which helps to soften the cervix. Excuse me. So it's quite often suggested that couples have regular sex to try and induce labour. Remembering that when you have sex, that releases oxytocin. So that's the hormone, the love hormone, which helps to induce labour, which helps your labour to start progressing. One of the things that I suggest is that if you're going to have sex, then it's really important for women to elevate her hips and her legs afterwards, after ejaculation. And that will allow the semen to remain around the cervix so that it starts to help softening, releasing more prostaglandins to start softening the cervix and effacing the cervix. So that's what you need. It is safe to have sex unless your membranes have released, so that's if your waters have broken. If your waters have broken, then you're more at risk of infection, so you don't want anything, being inserted into the vagina. It's also not recommended to have sex if you've got low-lying placenta or if you've experienced any bleeding, vaginal bleeding. Now, one of the things to keep in mind is that oral sex may be better for women so that they reach an orgasm rather than just having sex. So you deserve to have that pleasure. A lot of American sites, when I was doing my research, a lot of American sites actually promote oral sex. So, so in terms of you having oral sex with your partner and then swallowing the semen, and the thought is that this is absorbed more easily through the gut than the vagina to actually help stimulate the release of prostaglandins. I did contact one of the professors over in one of the universities in America to ask, because that was one of the things that he was actually promoting in his classes. And when I asked for some research, he actually said that he was retired now and all his research wasn't done electronically, so he couldn't actually send me anything, which was really interesting. But just talking to other birthing professionals, we agree that a woman who has an orgasm can actually help to stimulate labour herself. So if she's getting an orgasm, when you have an orgasm, that spasm through the body, the oxytocin being released as well. So that's a really good way of trying to help stimulate the release, to stimulate labour. So what I suggest is like Ina May Gaskin, if a woman doesn't look like a goddess during labour, then someone isn't treating her right. And now you know what's the best way for someone to treat you right. So nipple stimulation. So when you stimulate the nipples gently by rubbing or sucking or licking, you're likely to release the hormone oxytocin, which stimulates the uterus to start contracting. You do need to stimulate the whole area around the areola firmly but gently. So you're sort of imitating the sucking of a baby. This method can take quite some time, so for up to an hour, 3 times a day, with little or no results. Some women get lucky, by nipple stimulation, and some women just find that it makes their nipples really sensitive and quite irritated. So you can try that and just see how you go. You might be one of the lucky ones that really does help to start things in the right way. So hypnosis. I'm a really big fan of hypnosis to help pregnant women prepare for labour and birth. So again, this forms part of my belief that the mind, body and emotions all need to be in balance. If the mum is worried, if she's concerned, if she's fearful, or there's a lot of stress surrounding her at that moment, then she's less likely to go into spontaneous labour. So I perform fear release hypnosis in my hypnobirthing classes, and I also offer this to women on an individual basis where I've really experienced good results. So for example, a woman who's worried about her other children, for instance, or still working right up to the end of her pregnancy, or if their partner is FIFO and he works away, so there's that risk of him missing out on the birth, or there's been a traumatic incident in the family, maybe a death or something like that. So that can play an enormous role in inhibiting labour. Again, there's very little evidence, and I put that in inverted commas, to support that hypnosis could help to induce labour. However, a recent Cochrane review suggested the following: a complementary and alternative medicine method, such as hypnosis, may provide a safe alternative method for inducing labour. So that's a really good, a good review. So I really recommend that if you've got those fears, if you're stressed, got doubts about your body, then go and have a fear release hypnosis, or even download the Hypnobirthing Australia fear release track that you can just listen to on a regular basis and help yourself get back into that really beautiful, calm state. The other track, Melissa Spilstead from Hypnobirthing Australia has released this beautiful track, Baby Come Out. And that again helps mums to feel calm and relaxed and ready to go into labour. It encourages the mum to visualise her birth, the birth that she wants to have. So this is the track that when women come to me for a labour-focused massage, I do the first hour, which is the pregnancy massage, and that's to focus on releasing all the joints and ligaments, particularly around the pelvis and the sacrum. And then the last half an hour is the acupressure points. And then I also play this Baby Come Out track, and it's absolutely beautiful. It really is so gorgeous just to see the mums breathing out and releasing and letting go. Their body is so relaxed and calm. Their mind is so relaxed and calm. So it's a great track to listen to. It's not about inducing you. It's actually about visualizing the kind of birth that you want to have. It's about visualizing you being prepared. It's about feeling confident and strong, and embracing that your baby is going to be in your arms very, very soon. So, but again, if your body is not ready to go into labour, you know, all this is going to do is help you feel calm and relaxed and prepared for when you do go into labour. So it encourages that deep relaxation and letting go. So one of my favourite essential oils, and I see this, you know, promoted so many times to women that are trying to go into labour, and get some Clary Sage. Get some Clary Sage. That'll make you go into labour. So first of all, Clary Sage, don't confuse that with sage. They're totally different, okay? And Clary Sage can't be used to induce labour, again, unless your body is ready to go into labour. What it does do is facilitate whatever is going on in your body at that time and help you to have more effective contractions once you do start to have them. And it works on the central nervous system to relax the mind, the body and the muscles, which again is what I've been talking about. So this is what is needed for mums to go into labour in the first place. So something that can counteract the catecholamines, so the adrenaline going into the body through stress, and start stimulating endorphins and oxytocin. So a great oil to use to try and facilitate labour once your body is ready. So by using Clary Sage for relaxing and calming the mind and the body and the muscles, you're more inclined to go into labour spontaneously. However, don't use Clary Sage before 37 weeks, because if your body's trying to go into premature labour, then you don't want to try and facilitate that, okay? So it is a very powerful oil. The downside of using Clary Sage is because it is so powerful, it has a very strong smell, and there are side effects like dizziness and headaches and nausea. And also the mums can start to feel quite high. So if you're using Clary Sage during labour, remember that the birthing suites at the hospitals are not well ventilated, and all essential oils should be used in a well ventilated area. So I suggest that mums put a couple of drops of Clary Sage onto a hanky, or I use the Chuck's super wipes, and then smell that as you need it. And if that oil starts to become a little bit too overpowering, then just put it into a seal lock bag and put it away for a little while, and then bring it out when you need it again. So that's a really good way of using essential oils. Also, using Clary Sage on the acupressure points may help to stimulate those contractions when they start as well. So, but also looking at that relaxation. Again, you know, totally focus on that relaxation of the mind, the body, the emotions. Evening Primrose Oil. So this is an oil from the seed of the evening primrose plant. When I was researching this, so a lot of women, again, are recommended to use evening primrose oil. They're being told to insert that vaginally. And initially, years ago, I also used to recommend women use the evening primrose capsules and insert that vaginally. That would dissolve, and then the oil would be around the cervix. Research has actually shown that there are concerns with using this, and the main one is that it can trigger seizures for those with a history of seizures. It is contraindicated in those taking mental health drugs. So if you're suffering from depression and you're taking medication, it can affect that. The GLA in the evening primrose oil might slow blood clotting and could cause an increase in bleeding during or after surgery. So this again is a real concern during a cesarean section or postpartum hemorrhage. So it's probably one that you'd want to really work with a naturopath on this and find out whether or not this is going to be good for you to use. It can also cause bleeding and premature contractions. So other side effects that I came across were upset stomach, nausea, diarrhea, and headaches. So again, what works for one person or one woman may not work for the next woman. So so just work with someone who's qualified in in knowing about evening primrose oil so that you get good advice. Homeopathy is a form of alternative medicine that helps to stimulate the body's own healing response by using diluted preparations. So you can get that in the form of liquid, granules, powder, or tablets. So I've actually had a few clients that have used homeopathic remedies to help them all through their pregnancy, and then to promote labour or to help them through their labour, and then through birth with really good results. Again, you would actually need to see someone who's qualified in this. So there's not that many studies undertaken on this form of treatment. So who knows if it's safe or not. So again, I really encourage you to work with someone who specialises in homeopathic remedies. You can contact the Australian Homeopathic Association so that you can get a list of practitioners in your area. So you'll need to do your own research and find someone who is qualified, who does specialise in pregnancy, labour and birth. So I recommend that you contact the association and ask them questions, or check out their website as well. So you're probably looking at this and saying, hang on a minute, that's not a natural induction method. So I've actually included this because I have heard healthcare providers and other women suggest that a stretch and sweep is a natural form of induction. So that's why I'm including this here, only to educate you. Okay, in my opinion, anything that is trying to make you go into labour before you're ready is not natural. Excuse me. I do have a cold, so I'm sorry that my throat's a bit croaky and I have to keep clearing my throat, but I'm sure Dave's going to erase some of those from the video as well. So the stretch refers to the process of your healthcare provider inserting their finger in through the vagina, up to the cervix, putting their finger into the cervix and then stretching it. Okay, so that's the stretch part of it. The sweep refers to the separating of the membranes from resting against the cervix. Okay, so they basically insert their finger through the cervix, sweep around the inside of the cervix, and hopefully the theory is that stimulation of the cervix will start to release the hormones that you need to go into labour. Couple of things. The cervix needs to have softened. It needs to be favourable to it and slightly open to enable that healthcare provider to actually do the stretch and sweep. Okay, so they need to be able to get their finger inside the cervix and sweep around. So obviously your cervix needs to already have softened. If your cervix is already soft and slightly open, then your body is already preparing for labour. So why not just leave it alone? When a cervix is not ready, so the texture of your cervix when you're not ready for labour is like the tip of your nose. It's hard and grizzly. So just feel the tip of your nose now. It's really hard and grizzly. If your cervix is softening, it'll feel really soft and stretchy and flexible, like your lips. So just feel your lips now. You know, you can pull your lips and you can stretch it and you can twist it around. Okay, so that's how your cervix needs to be for you to have a stretch and sweep. That's called being favourable. It can be really uncomfortable, even painful, and it may even cause bleeding. And the big thing is it may even rupture the membranes, okay? And once your membranes have ruptured, then you're on the clock, okay? So depending on your hospital and their policies, at some point you'll have to be administered with antibiotics within a certain period of time, particularly if you haven't gone into labour. Some hospitals make women go straight in as soon as their membranes have ruptured. So this, again, can cause stress and anxiety, start releasing catecholamines into the system, and then you're inhibiting all those labour hormones. So it's much better for you to be at home, you know, being at home in your comfortable, safe space to go into labour. Sometimes with the stretch and sweep, you may get a few contractions and you start to get really excited and hopeful, but then they don't progress into labour, okay? And then you start to become disappointed. You start to get more stressed. Again, you start releasing those stressor hormones, inhibiting your labour hormones. So this method can be effective for some women and then totally useless for others. So I actually know a woman who had 7 stretch and sweeps, okay? And when I asked her why she felt that she had to keep going, and she said, well, so many other women have stretch and sweeps and go into labour. So she thought that it would work for her. Obviously, it's not going to work for everyone. Here's my biggest catchphrase. What works for one woman may not work for the next. Again, get back into that calm, relaxed space. You know, do things that are going to help you feel calm and relaxed. Raspberry leaf tea. So we love raspberry leaf tea. It's a uterine tonic and it helps your uterus to work more efficiently during labour. It's not designed to induce or speed up labour, but to help your contractions be more effective when you are in labour. The uterus becomes more relaxed, which causes the contractions to work more efficiently. Therefore, what it does is it can shorten the time of labour that a woman experiences. So it's suggested that women start taking raspberry leaf tea from 32 weeks and then continue all the way through to birth. So again, not much research has been conducted on the safety and the side effects of using raspberry leaf tea during early pregnancy. Raspberry leaf teas are high in tannins, which can cause constipation. So again, always refer to your naturopath or someone who's qualified in knowing, you know, how to recommend this particular technique to you. So I think I said already that you would use that from 32 weeks, yeah. So using raspberry leaf tea from 32 weeks as a uterine tonic. So dates, eating 6 dates daily from 36 weeks increases your chance of going into spontaneous labour. So a recent study concluded that eating those dates, so six dates daily, that's a bit of a tongue twister, eating 6 dates daily during the last 4 weeks of pregnancy significantly reduced the need for induction and augmentation of labour and produced much more favourable birth outcomes. So I really recommend, I've had quite a few mums now who have done the dates, gone into spontaneous labour and had really positive labours as well, so quite short labours, so 6 hours, 9 hours, you know, that's probably not too short, but going into spontaneous labour, so not having that fear of having to be induced medically. Spicy foods. So spicy foods and curry can give some people diarrhea. So another one to think twice about, particularly if you have a sensitive stomach or you're not used to eating hot and spicy foods. It can cause dehydration. So this can cause your uterus to start contracting. However, usually those contractions subside, peter out. And that makes mums more distressed and then labour doesn't progress. So one article I read not long ago suggested that the capsaicin in chili was an inhibitor of endorphins, which are your body's pain-relieving hormones that you need during labour. So it's probably not something that you'd want inhibited. You want to make sure that your body is producing lots of endorphins to, you know, as your pain-relieving hormones. So, but then again, I've heard women swear by having spicy foods. So what works for one may not work for the other. Pineapple. So this is a very popular one and I see it suggested all the time in the forums. So pineapple and other tropical fruits like kiwi and papaya contain an enzyme called bromelain. So this is thought to stimulate the release of prostaglandins to help soften the cervix and stimulate the uterus. The process of canning or juicing destroys the bromelain, so the fruit has to be fresh. However, don't get too excited. Each pineapple only contains very small amounts of bromelain, so you'd need to eat as many as 7 or more pineapples in one sitting to have any effect. So basically the side effects of eating such large quantities of pineapple would be diarrhea, cramping, tummy upset and heartburn. Pineapple is also very rich in natural sugars, so not very helpful with those who have gestational diabetes. But it's also really high in vitamin C and can help with constipation. So, you know, you've got to weigh up the positives and the negatives. The black cohosh and blue cohosh are two different herbs. Both of these herbs have been used for centuries to induce labour or increase contractions in a slow-moving labour. They're more effective when used past your estimated due date, and again will not trigger labour if the body is not ready. So the two herbs, when used together, help to strengthen and regulate the uterine contractions and work with your body in a natural way. Again, you would need to see a naturopath or someone, a traditional Chinese medicine practitioner. So another good one, but you need to go to someone who's qualified, who can administer that to you. Natural licorice is not the same as the black lolly licorice that you get from the shop. Okay, so licorice, natural licorice also contains an enzyme that stimulates prostaglandin levels and can trigger contractions. Again, eating a lot of licorice can be like taking laxatives. So the stomach contractions that you get could stimulate uterine contractions. However, there's not a lot of research to support this idea. A study that I came across, published in the American Journal of Epidemiology in October 2009, suggested that the enzyme found in licorice affected the placenta and allowed stress hormones to pass through to the unborn baby. So that's something to consider as well. So we know that being upright helps with gravity and may help to encourage the baby further down into the pelvis, therefore putting pressure on the cervix, which may help to trigger the release of prostaglandins and then oxytocin. So one midwife that I was working with when I was a doula for a mum suggested to the mum that she could walk up and down the stairs and walking sideways like a crab, because that helps to open the pelvis a lot more than just walking up and down the stairs. She actually felt, you know, that was really good for her, and she could actually feel baby pushing up against the cervix. She could feel that sensation. But I also think that swaying your hips from side to side and forward and backwards and rotating your hips one way, rotating your hips other way can also help to loosen off the muscles in the pelvis, and then therefore helping the baby to actually move down. Safety again in mind. If you're using the stairs, make sure that you're holding on to someone or that there's a railing there, so making sure that you're not going to fall. Going out and getting regular exercise, going out in the sunshine, taking deep breaths, soaking up, you know, the day, the smells, allowing yourself to just be with nature. You know, again, it's that whole relaxation side of things. You don't know how long you're going to be in labour for when you actually do go into labour. So you don't want to exhaust yourself before you've even gotten started. Also, if you're not used to strenuous exercise, then you don't want to start running a marathon, you know, because your body's not used to that. So what I want you to do is actually think about a marathon runner. They don't sprint out of the starting box like a 100-metre sprinter. They take it slowly and steadily. They breathe. They get into a rhythm. They conserve their energy for that long road ahead. I couldn't find any research to confirm that walking will induce labour or even encourage your baby into a better position. However, it does make sense to me that if you're striding forward or stepping sideways, even moving up and down the stairs, that movement and that gravity will help baby to move down. The same way, like I said, the rocking, rotating, bouncing on a fitball, rotating your hips one way and then the opposite way as well. So just making sure that you're being active, but not over-tiring yourself at the same time. and the Taj Mahal of all natural induction methods, castor oil. So this is not a technique that I would recommend. But I see it still being recommended and suggested to pregnant women to help induce labour. I'd be more concerned about the side effects of this and possibly causing more complications for your birth. Highly recommend that you do your research and speak to your medical practitioner before even considering this. So castor oil is a pale yellow oil made from the castor bean. It's used as a laxative, it's used as a lubricant, and it's also used in manufacturing oil-based products. So a study done in 2014, which contraindicated the previous study of 2009, concluded that taking castor oil increases the chance of meconium-stained amniotic fluid. And most side effects caused by taking castor oil were fatigue, nausea, vomiting, cramping, and diarrhea. And also, it affected the newborn's APGAR scores in that first minute as well. So this is one that I would really steer clear away from. So what do you do? The main thing, be patient. Keep your baby safe and supported and nurtured for that little while longer. The greatest gift that you can give to your baby is your patience. Your number one priority is to keep your baby safe and supported, even if that means for that little bit longer. You can be sure that you're not going to stay pregnant forever. So there are circumstances where a mother may need to be induced for medical reasons, but until you're in that situation, I really want you to focus on being calm, nurturing yourself, and also looking after your baby. It doesn't matter what you do to speed things up. If your baby and your body are not ready, then you're going to be disappointed when these natural induction methods don't work. Dating and growth scans are rarely accurate, and I do have several studies that I can send through to you if you would like to see those. So because they're not accurate, you may be stressing for no reason. Remember I said that normal pregnancy term is anywhere between 37 and 42 weeks. Also, the whole big baby issue. So I've heard of many babies born who were told, mums were told that they were going to be big babies, suggesting a 9-pound baby at birth. And then when the babies are born, they're only 7 pounds. So, you know, we just can't focus on this this fear-mongering of big babies and having to get babies out by 38 weeks. Okay, so I've almost stayed within the time. So does anyone have any questions? If you do have some questions, you just need to type them in the chat box there. And if I can't answer the question, then I'll find out and I can send you some information and email that through when the video gets sent out to you as well. So while we're just waiting if anyone's going to type in any questions, just want to tell you about my Back to Basics Birthing online course that I've just, I'll be launching. And it's a comprehensive guide to pregnancy, labour, birth and beyond. It's all about childbirth education. It's all about everything I talked about tonight. It's all about the mind, the body, massage, teaching you different techniques to help you with your labour and birth, teaching you acupressure points, helping you find ways to release endorphins, and just helping you go back to basics. You know, we need to go back to basics. We need to stop medicalising birth. We need to start giving women confidence to birth, you know, more calmly, more positively. So the link to register for the early bird price, Dave's just popped that into the chat box there for you. So it's $195 and that'll be available for the next week. and then it'll be going up to $295 for the full price. So this course actually gives you a workbook for each different area, each different module. There's 6 modules. It also includes meditation downloads. It also includes videos for techniques so that you can actually see how to do the massage and acupressure points. Using essential oils, so I cover essential oils in detail as well, and lots of information. And you get this for forever, for as long as, you know, I'm operating, so that you can continue to refer back to that when you have your next babies. Okay, so there doesn't seem to be any questions there. Does anyone want to ask anything? If not, I'll be closing the session. Okay, so you will receive the video link to tonight's session, along with different research that I've put together in links as well. So thank you for being with me tonight, and I really hope that you've enjoyed the session on natural induction methods. And if there is anything that you'd like to ask me or you'd like more information on, just drop me an email to vicky@vickyhobbs.com. So I look forward to working with you beautiful pregnant women, and hopefully I'll get to speak to you soon. Thank you. Bye, everyone.